Coming up on Mayo Clinic Q&A, a look at breast cancer survivorship.
I feel that the diagnosis is always very hard. The hardest period of time is actually from the diagnosis until we start to make a plan. People are very worried. They don't know what the future brings, the treatments. After we discuss the treatments, people psychologically start to feel better, but then the physical issues start to occur after the treatments.
If breast cancer is found early, there are more treatment options and a better chance for survival. Getting checked regularly and living a healthy lifestyle can put your mind at ease and may also save your life.
Breast cancer is actually a very good prognosis cancer, generally speaking. We know that a very balanced lifestyle is important from the breast cancer survivorship, and exercise, diet, keeping your weight normal, stress management. Try to have a very balanced life. I feel that making yourself a priority that way is important.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States, but it can occur in people of all gender identities. Fortunately, thanks to earlier detection and advances in diagnosis and treatment, most people diagnosed with breast cancer will survive their diagnosis. People who survive breast cancer do have unique needs depending on their cancer type and stage, but there are some experiences that affect many breast cancer survivals and are shared. Joining us to discuss is Dr. Daniela Stan, an internist at the Mayo Clinic Breast Diagnostic Clinic. Thank you for being here today, Daniela.
Thank you so much for having me. Very excited to be here.
Well, because this is such a common topic and such a common issue for so many women, I thought it was vital that we talk about this. What are people most worried about after they complete their treatment for breast cancer?
Most people, the most common symptom or worry I hear is actually the fear of recurrence.
Yeah.
I think it's very important to address that in the beginning, try to settle that issue, try to inform people of the risk of recurrence and what they can do about it. Secondly, probably all these physical or other psychological issues, physical issues from the surgery, from the medications, from the chemotherapy, then psychological issues, anxiety, depression can happen after a cancer diagnosis and treatment.
What kind of coping strategies do you try to encourage your patients to use to deal with these worries?
Most of the time, people have some resources either in their family or in their primary care doctor. We do have a system in which we refer our patients to oncology, psychiatry. We have a great group of psychologists, so I feel connecting to a psychologist through your primary care physician or in the community would be very important. Friendships, knowing your friends, knowing who cares, try to spend a lot of time with them seems to be very, very supportive for women. Family, of course, involving people in your diagnosis as much as people are comfortable. Not everybody is comfortable sharing the diagnosis, but for those who do, I think family and friends are very important. And of course, if there is established depression, anxiety, beyond that, what's expected from a cancer diagnosis, something that lasts for a long time, referral to a psychiatrist would be important to consider medications.
Daniela, I've been very open about my own diagnosis and treatment with breast cancer last year. At the time that I was going through it, thinking about what I would experience afterward was not even on my radar. Literally, all I was thinking was get rid of this breast cancer and then I will be fine. So what should patients be ready and prepared to ask their doctors about what they might face after breast cancer?
I feel that the diagnosis is always very hard for people. And I think the hardest period of time is actually from the diagnosis until we start to make a plan, psychologically wise. Mm-hmm. People are very worried. They don't know what the future brings, the treatments. After we discuss the treatments, people psychologically start to feel better, but then the physical issues start to occur after the treatments. So I feel that people should know the roadmap, what treatments are they expected to have, and the timeline of these, how long will they be incapacitated physically or psychologically sometimes, what can impact their work schedule, what can they do if they have to receive chemotherapy, what type of activities they can attend, what's safe, what's not safe, what can they eat. Sometimes there is a lot of nausea associated with the chemotherapy. So we have resources in which we educate our patients, classes on chemotherapy, diet, nutrition, what can you eat, what can you not. Fatigue is a big issue pretty much through the whole treatment. Fatigue is pervasive. A lot of people go through that. So just preparing that for how to deal with fatigue. We have fatigue classes. We have physical therapists that are dedicated to help people with that. So just knowing how to deal with that on a daily basis, how to pace yourself, how to get help from your family and friends, how to go forward. And after the treatment is completed, many resources are available to deal with, again, the physical and the psychological issues.
Daniela, you mentioned some of the short-term effects of therapies for breast cancer, such as nausea and fatigue, et cetera. Tell us a little bit about long-term effects that individuals might experience after going through treatment.
Yeah, it depends on the type of treatment, of course, but the mainstay treatments for breast cancer are surgery, radiation, sometimes chemotherapy, almost always anti-estrogen treatment if the cancer had an estrogen receptor. So long-term treatments related to surgery, from a lumpectomy, pretty low, although we do see long-term discomfort in the breast and the chest wall that was radiated. From chemotherapy, we do expect to see neuropathy. Sometimes brain fog is a very common symptom that tends to go away after a year. Neuropathy tends to stay a bit longer. It's treatable, not always curable. Some people, unfortunately, do develop heart problems from the chemotherapy. Very rare, but it happens. So it's something we need to follow, the heart function. The common treatment is anti-estrogen treatments. And from that, we see people who take it without any problem whatsoever, but others have multiple symptoms of menopause-like problems with hot flushes, maybe some vaginal dryness, maybe some achiness in their joints. From tamoxifen, we have to be careful about a small but real risk of uterine cancer, strokes, blood clots. From the other group, the aromatase inhibitors, we have to monitor the bone density, make sure we keep a good eye on it, treat it if it's needed, if the bone density goes down, all this problem. And then, of course, the potential psychological issues, anxiety, depression, those are very important to treat because it seems that the risk of recurrence is to some degree correlated with the degree of stress after a breast cancer diagnosis. So trying to bring that stress down seems to be important for survival.
That's very interesting. So what are a couple of key things that you tell patients to do to prepare for breast cancer survivorship?
The most important thing, and this is something I'm very passionate about, was shown over and over to be beneficial in the amount and the quality of survivorship is regular exercise. That's what I tell my people. Try to do something, if possible, every day. The guidelines say every cancer survivor of any type of cancer should exercise at least 150 minutes a week, moderate exercise, or 75 minutes a week of intense exercise, plus 2 days of strengthening exercises. So that's the main issue I discuss with them after the treatments are completed. Even before, I give them a roadmap and I tell them this is probably not the best time to think about starting a regular exercise program, but on the long run, I feel you really have to take an hour a day for yourself, maybe increase to 2 hours a day for yourself. Try to exercise regularly, try to do something mindfulness wise, maybe some yoga, maybe some walks in the nature to try to decrease that stress. So exercise, stress management, eating a very healthy diet, which doesn't mean a diet, just means a very common sense.
Making good choices.
Exactly. We usually recommend the Mediterranean diet, which avoids as much as possible processed foods, red meats, alcohol if possible. We used to say less than 4 alcoholic drinks a week is reasonable. As of recently, there is a study showing that actually any amount of alcohol increases a little bit the risk of recurrence. So we tell people try to avoid it. Doesn't mean that on occasion you can't go out and have a steak and a glass of wine celebrating something. It's reasonable, but try to follow your calorie intake, try to keep it under normal limits, and try to bring your weight under reasonable, healthy limits.
Daniela, you mentioned that one of the biggest concerns that individuals have after a diagnosis of breast cancer is that it could recur. What do you do to help speak to that concern for patients or tell them to plan to do?
I feel it's very important for our patients to be empowered and educated. And I give them the information I can. They of course worry. They think every single symptom can be related to breast cancer. So I think educating them for them to know exactly what we are looking at when we worry about the symptoms of recurrence. So we talk about if you have a persistent symptom, the most common type of breast cancer is estrogen positive, and those most commonly travel to the bones. So I focus on that. If you have a persistent bone pain that's in the same place for 2 or 3 weeks, doesn't go away, doesn't come and go, it's there almost all the time, I want to know about it. More rarely, the cancer, especially the estrogen negative, can travel to the liver, to the lung, to the brain. So I tell them if you have a persistent pain in the liver area, in the upper abdomen area on the right side, or in the lung area, or a persistent cough, chest pain, I would like to know about it. A persistent headache, again, 2-3 weeks is what we are looking at. That's just not a typical headache, doesn't go away easily. That's something we want to know about.
So even for a woman who has no evidence of cancer after treatment, what sort of plan do you put them on as far as imaging or check-ins with physicians, et cetera, to help relieve that stress of recurrence?
Very important for them to know this information as well, because a lot of people are expecting blood work, are expecting PET scans or CAT scans to look for signs of recurrence. So we talk a lot about what the guidelines are and what we recommend. And really, the guidelines only recommend a breast examination every 6 months for the first 2 years or 3 years at least, and then every year. Usually at Mayo, we do it every 6 months for 5 years. And then a mammogram, if your breasts were conserved, you need a mammogram once a year, not more often than that. Occasionally, if people had mastectomy with breast reconstruction, you have implants in there. The implants have to be screened for rupture, not for recurrence, but every 3 to 4 years, we do a breast MRI to just check those implants. And I do tell my patients, why am I not doing blood tests and why am I not doing PET scan, is because there were studies showing that there is no survival advantage in people who have these very intensive workup every 6 months or every year. And those people that did had a lot of biopsies and a lot of anxiety actually caused by these tests, and it did not prolong survival. So that's why, again, educating my patients about what to expect, what to look for, and only in those situations, if they have those persistent symptoms, then we would do a PET scan or a bone scan, something specific to the area of discomfort that was shown to be beneficial for people in this situation.
And we know that you don't go through a cancer diagnosis alone typically, or we hope not. And so what can, Daniela, family, friends, and caregivers do to help the breast cancer survivor?
A lot of the times in the beginning, when I see my patients coming to the breast clinic for their first ever visit, there is a lot of anxiety. They typically bring a friend or a spouse, whoever they feel most comfortable with. And those people are there to listen, to help make decisions, to take notes sometimes. very helpful in the beginning phase. Some people bring their friend for the chemotherapy or other radiation treatments. So supporting the patient, the person who has breast cancer through those treatments, be with them for those treatments, I think would be very, very beneficial. Helping them share the news with the family if they choose so, or with the extended family or with the other friends, helping them do that, set up a website, things like that, for people who feel comfortable, who want to have that. Some people are very private, so maybe the family and the friends should understand that not everybody wants to share, not everybody wants to become a champion of this cause. And beyond that, after the treatments are over, maybe just listening. I know that a lot of my patients are saying, nobody wants to hear me anymore. It's like everything is over, the treatments are over, and we need to move on. And that's a time where it's a vulnerable time. People do not feel comfortable because that's where the intensive treatments are done and they feel sometimes abandoned. So I feel that's a time when the family and friends can maybe step in, just listen to them, just understand their fears, encourage them to talk to their medical providers if it's needed. And beyond that, everybody knows about, maybe a gift card for meals, things like that. It's always helpful during the treatment phase. But after that, just make sure you keep being social. If you had breast cancer, keep interacting with your friends, with your family, communicate, and with your care team. I think it's very important to stay in touch if you have any of these prolonged symptoms, either psychologically or physically. We need to know because we can help.
Daniela, it has occurred to me, the more years that I have spent practicing medicine, that before going to medical school, I believed I was going to learn all these things about the human body and how to fix things and how to prevent disease. And now I am incredibly acutely aware of the physical is only part of an illness when we suffer from it. And there's so much more that goes into it. Do you have any last words of wisdom for our listeners as they consider breast cancer survivorship themselves or for someone that they love?
I feel, again, it's a very personal experience for everybody. I think that maybe this is an opportunity to realize it is my time to get better, to maybe improve whatever I can in my lifestyle. Maybe it is time to slow down if I was too stressed out and too involved with projects and overwhelmed, again, because stress is important. Maybe it is time to take a time in the day for myself and pay attention to my needs, do something different than that I always wanted. And again, not with the idea that the life is ending. Breast cancer is actually a very good prognosis cancer, generally speaking. But with the idea that we know that a very balanced lifestyle is important from the breast cancer survivorship. And again, exercise, I know I keep saying that, but it is very important. Exercise, diet, keeping your weight normal, stress management, and actually sleep. Sleep is very important in all our diseases pretty much, and in breast cancer as well, especially because some medications can impact sleep. So make sure you sleep at least 7 hours a day. So try to have a very balanced life. I feel that making yourself a priority that way is important, and maybe have your family restructure their priorities as well to understand that you need maybe more time for yourself.
Great words of wisdom, Daniela. Thank you for being here today.
Thank you so much. All the best to everyone.
Our thanks to Dr. Daniela Stan, internist in the Mayo Clinic Breast Diagnostic Clinic, for being here today to talk to us about breast cancer survivorship. I hope that you learned something. I know that I did. We wish each of you a wonderful day.